This hurricane season's already off to a busy start, and this year the COVID-19 pandemic adds another layer of safety precautions that we need to think about. Touro Family Medicine Physician Dr. Meredith Maxwell joins us with some tips this morning. Good morning.
Good morning.
Boy, it really does make it more important to plan than ever.
It does. I mean, I think you really have to think about this hurricane season, some extra things that we need to think about, to bring, to put in our kits that we have. Your hand sanitizers are going to be extremely important. Think about when you go to a store, try to avoid peak hours, get your masks ready, get your disinfectants ready, and add that to your prescriptions, your 3-day supply of water, your 3-day supply of food, and have it all ready in an accessible spot. Maybe a little one in your car and maybe one in like a Foot Locker in your house that's accessible.
Or if it's in the extra car, make sure to grab it. And hand sanitizer,
exactly.
For example. I have noticed that sanitizer is starting to become more available. I can think of one convenience store in particular that has loads and loads of it, but that will probably go pretty quickly if we do. Hopefully we won't, but if we do get into another bona fide threat.
That's right. So you see it now, but if you get into hurricane season and people start prepping early, that's going to go quick. So you want to really think about that earlier rather than later, before it's all gone and everybody's trying to get it at the same time. I think that it's really important to know that city-assisted evacuation is still going to happen. Masks will be provided, and they're going to socially distance as much as they possibly can, but it's not going to be perfect. So really prep with those masks, your own sanitizers, your own disinfectants, so that you can be a little bit in control.
We're learning more about how this spreads. So off the reservation just a little bit, if you are not able to socially distance, how much extra protection is a mask?
It's the best we can do at this time. The CDC just came out with some new guidelines regarding eye covering as well. So I do want to say that I see these people in just the face shield. That is not enough. You need the mask under that as well. And I cringe whenever I see it. You're just protecting your eyes. You can still have particles get under that mask.
Well, or have material go out for that matter, because you're
correct, because you are protecting yourself you're protecting others from yourself and vice versa.
So I guess the bottom line is prepare early, and then just, if you are in a situation where you're around crowds, just take as many precautions as possible.
Right, and don't wait till the last minute to get this stuff prepared, because it won't be there when you're looking for it.
Well, that's a good point. All right, Dr. Meredith Maxwell from Touro, appreciate your time this morning as always. Thanks.
Thank you.